The world of surgery is a dramatically changing environment, and we have been able to take critical steps, I think, to keep us at the forefront of this changing world.
The Surgical Technology Integration with Tools for Cognitive Human Factors, or STITCH project, is aimed at improving technology to make laparoscopy and other types of minimally invasive surgery less stressful, both physically and mentally, for the surgeon.
This project began as a collaboration between surgical practitioners and technologists, and the key thing that we wanted to solve in coming together was a way to apply advanced technology to the surgical environment.
I think we've been very lucky to really pull together a large team of individuals from very, very different areas.
Putting together this team, utilizing this funding, we've been able to take all of these elements, bring them together, and this will put Kentucky at the forefront of this rapidly changing medical world.
One of our goals is to make sure that the new medical technologies serve the users, serve our surgeons. We don't want the technology to overwhelm our surgeons. One of the topics that I'm particularly interested in is the concept of mental workload and also situation awareness.
It's a hard procedure to do, and it takes a long time to be trained to do it right. And I mean, if I gave you chopsticks and I asked you to tie your shoes with them, you wouldn't be able to do it for a very long time, right? And that's what these guys are doing. They're tying knots with chopsticks through a hole inside someone's body. You know, it's really amazing that it can be done.
Surgeons have to know everything surgeons knew in the past, as well as new technologies, coming from the laparoscopic angle, or where you have tools where they have to work differently and view things through television cameras, now working robotically or working in sort of virtual spaces. So the burden, the educational burden cognitively, procedurally on surgeons now is much more than it ever was.
How we practice medicine today and how we practice surgery in particular today is vastly different than what we did as little as 10 or 15 years ago.
New surgical technologies have transformed methods of treatment for both the patient and the surgeon, but they have also created the need to improve surgical training.
What we hope for the long term is that we can use these tools to help develop better training procedures, which of course can benefit Kentucky in the long run.
The more we can accomplish, the safer we can teach, all of these things will go to make surgery safer and have better health care for those that reside in Kentucky and beyond.
Thanks to funding for the STITCH project from the U.S. Army, technologies are being developed for advanced medical techniques that can be used on the battlefield and in the general surgical environment.
As our soldiers and our sailors and airmen on the ground, if they're injured, should know that their surgeons are competent and that are the top experts in their field.
When all these things come to fruition, we truly will have an improvement in healthcare that will be absolutely phenomenal, and I'm really excited about that.